Okay, so we're recording, and now I'm going to make Sarah the host. You should be the host now. Okay.
Eric, when you change host, actually it tells all of us, FYI.
Okay. So FYI also, if somebody is not paying attention to their mute button, Sarah, you should feel free to mute people. You have that capability.
Yes, I'm on it, definitely.
Also,
Sarah, you have the control.
Okay.
You are also in charge of hitting the broadcast button when it's time. Do you see it up at the top of your screen?
Yes, I do.
Okay, so at 5, or I would say 4:59, another 2 minutes, you go ahead and start broadcasting.
But you're going to be coming back to end it when we're done.
Yes, I will pop in a couple times throughout just to check on everything, and then I'll pop in again at the end just to make sure that that it's closed and that the recording ends.
Sounds good.
So we now have 16 on as panelists. Does that mean that Mike Wasserman and someone from Dave Cortese's office?
Dave is here. He's here. I see him.
Oh, I see Dave. I do.
Hi,
see
Dave. Thank you for joining us.
Hi, Dave. How are you? This is Candace Roney.
Hi, Candace. How are you? I'm
good.
Hello, Dave.
How are you doing?
Hello.
My face.
Thank you for being here with us tonight.
glad to be here.
Hey, Dave.
Dave,
This is Ken Wallace. I'm going to be introducing you. And I wanted to find out, did you want to say a few words?
Whoa,
Okay.
back talk. Mike Wasserman just joined.
Hello, Mike.
Hi, I'm here. I'm hearing you. Where are you?
Great.
Hello, Mike.
Well,
Oh, we're all over the place.
I'm not much to see, so as long as you're hearing me, that's okay. I've got both Dave and Mike, and I'm going to be introducing you. This is Ken Wallace, and we'll have Dave go first, say a couple of remarks, and then Mike, we'll have you go next. We were debating whether or not we should try to field any questions. I'm going to leave that up to Sara, our moderator.
I see you, Ken. All right.
And if we feel like we just don't have time, we won't, but thank you for being here.
We're at 4:59. I'm going to go ahead and mute myself. You guys have a great session.
Thank you.
Thanks, Eric.
Thank you, Eric.
This is Will Perry. Thank you.
Lights on.
Everybody, please unmute. Please mute yourselves. I'm going to go ahead and broadcast.
Thanks, Sarah.
All right. And we are on. Good evening, ladies and gentlemen. Welcome to another night of our town hall meeting series. Tonight we have a great program for you, a lot to cover. My name is Sara Hamed-Negahdar. I'm a board member of the Santa Clara Dental Society, and I'll be part of the COVID-19 task force. I'm also your moderator tonight. So again, I'm going to go over, if you haven't been with us on Tuesday, I'm going to go over quickly some rules for this meeting. If you have an iPhone, you can, you're going to see these QR codes throughout the presentation. And that is the quickest way for you to be able to access extra resources that we're going to present to you. If you have an iPhone, you're just open up your camera and bring it over to the code. It will scan it and it will give you a link to go to that web page. If you don't have that, you can go to the App Store and install one of these apps for a QR code reader. We have a lot of stuff to cover tonight, so we're going to go through the slides rather quickly, but please know that you can download this on our website. So you can download this manual at SCCDS.org, so you will have access to them later. Also, I want to remind everyone that for the purposes of our tonight presentation, for your questions, please only use the Q&A box or option and do not use the chat option, as we will not be supervising it. So only use the Q&A to put and post your questions. And I'm going to introduce the president of the Dental Society now, Dr. Balkan Nguyen. Dr. Nguyen?
Thank you, Sarah. Wow, what an interesting year I have as your president. I know that's been hard on all of us, and I want to thank you again to our wonderful staff, Candace, Megan, Eric, Katie, Tim, and of course, the great task force member who've been working very diligently these past few weeks for us. We know that this crisis has impact and affect all of our lives. I've actually learned to become a preschool and kindergarten teacher for my 2 little girls. Great admiration for the teachers, by the way. We've never faced anything like this before, and I'm happy to be a part of this task force. We're all on the same boat, and we're trying to get through it. I hope that you have enjoyed these webinars and find them informative. All of our panelists have worked very hard on them, and I want to thank you all for being here tonight. Now I'll pass it back to Dr. Ken Wallace, our task force chair, to get the program going. Thank you, Ken and Sarah.
Thank you, Bao, and welcome everyone to our 3rd evening this week of a webinar series, and we're trying to prepare our dentists to navigate through the COVID-19 crisis. Tonight is our largest night yet. We have nearly 500 participants logging in, many within Santa Clara County and some actually throughout the state. Well, this has been a very difficult time for all of us. It is our desire to help to just shine a little hope into the future as we get back into doing what we love, providing dental care for our patients. I want to just take a personal moment, if I may, and I want to share that this has been an especially difficult time for me with news that I received yesterday. We lost a dear friend, Dr. Andy Soderstrom, past president of the California Dental Association. He left us yesterday after suffering a tragic accident at his home earlier this week. Andy was a true mentor to me. He was a great coach as I went through my time as a leader at CDA. Andy just cared so much about helping others in all aspects of life. He was the guy that was responsible for bringing CDA Cares to California. You may not know that. I'd like to just ask 2 favors. First, let me just ask for a moment of silence. Thank you. And then second, with all due reverence, and I think Andy would have it this way, I poured myself a glass of red wine that I want to raise and toast to Andy and say that we love you, Andy, and we look forward to being with you again. Okay, let's move on to the next slide. This is our wonderful task force committee that's worked so hard on preparing all these seminars, and they're doing so many other things for you guys. I'm not gonna mention all the names, but you can see them there. These are people that have gone above and beyond a role of leadership. They're sacrificing their personal time to help you do what you need to do. And I just want to thank each and every one of them for all the work they've done. One thing that's come out just yesterday, and it's caused a little confusion, was a new county order from Santa Clara County, along with several other counties throughout the state. I'd like to just read the statement from CDA, because this right now is our official statement. Things are changing rapidly. County health orders being issued around California do not direct dentists to immediately go back to routine practice. Instead, they are letting the public know that they may begin to assess essential health services. Dentists are awaiting specific guidance from the California Department of Public Health, which is expected to be realized shortly. In the meantime, dentists continue to be available for dental care that is essential during this pandemic. The confusion that we received yesterday, we're trying to address. And tonight, we actually have 2 guests that are from the County Board of Supervisors from Santa Clara County that are with us. And let's go ahead and advance to that slide. Thank you. And I'm just going to introduce them and ask them to say a couple of words, and they're on our panel here, so you get to see them up in person. First, let me start with County Supervisor Dave Cortese. Dave, you want to say a couple things? You have to unmute yourself. There you go.
Thank you very much. Thank you for the opportunity to be here. Good to see you virtually, Mike. We only see each other virtually now. And I'll explain something right off the top. And I do want to say a couple very pertinent things, substantive things, if I could just have a couple of minutes. We have this little thing called the Brown Act in local government, cities, counties, other agencies. They don't have it in the legislature. The legislature just makes us have it, which says that you can't communicate with the majority of the board except in an open public meeting that's appropriately posted and published with an agenda and so forth. So Mike and I, although we both have some similar background, business backgrounds, actually went to the same high school and so forth. We agree on a lot of things, but we don't get to collaborate or discuss oftentimes some of the very important substantive background issues that you'll be discussing tonight. Although each of us, sort of in our own parallel universe, certainly studies up, we do work, in this case, we forward information to the public health officer, which I just want to touch on real quickly. But to give you an idea, if you're thinking Mike and I may have come here and collaborated in the past, I wish we could have, because we probably could get a lot done that way. But the rules are we have to wait till a Tuesday board meeting and talk, all together. That doesn't apply to us being here, so don't worry about that. This is all legal, even for the Brown Act. So I know I speak for both of us saying, we're happy to be here. I wanted to just point something out, a couple things out that might just be informational, and I hope I'm not stating obvious things you already know. But each county that has the ability through its public health official, in our case that's Sara Cody, not only the ability but the authority, and the sole authority and the independent authority to make these rules during an emergency that we're calling health orders at this time. But it's rulemaking that's outside the legislative process. The legislature can't overrule Sara Cody. The governor can't overrule Sara Cody if she issues an order that's more restrictive than he might issue. And we can't overrule Sara Cody the way the law is set up in California. It doesn't stop us from forwarding information, from exercising our rights on your behalf or through our own mental processes, to share our thoughts, to petition through the process and communicate. So we do that in this most recent set of orders where you saw some changes, particularly the construction industry and how that opened up. I played a role with a cohort of regional supervisors from the other counties of preparing pages of information, proposed and suggested protocols for how they might be able to open up more business than where we were at just a couple days ago. And so they're open to that kind of information. Now, what I can't do is say, all in favor, aye, and then force those things. Mike and I can't do that, but it's important to know that process can happen. And I just want to close my comments, unless you want me to say more, by saying that I, for one, would be very happy to replicate that kind of a process for the Dental Society. I understand, there's communications of work going on at the state level between CDA and the governor's office and so forth. But this county has been leading all the way along, and you almost get the impression just by watching the sequence of events, whether it's been the first shelter orders right up until yesterday, that to a large degree, the state, within a couple of days after we adopt some new rules, they adopt the same rules or very similar rules. So the county's in a leading position. That's the good news. But the people who know best how to structure business and practice, in your case, business and practice, whether it's car dealers, I'm not trying to lump you into any particular category, so don't be insulted, but whether it's automobile dealers or residential builders or dental professionals, doctors in your area of medicine, or others, faith-based groups, churches. How do you get churches open? You can pose the question, well, there must be a way, there must be a workaround that's safe, but the people who are best able to describe the elements of that work plan or that workaround plan, I believe, are typically the people who are in the business in the first place. I would rather have a church pastor, for example, tell me how he or she can keep people 6 feet apart, safe, sanitized, and non-infecting each other, before the public health official makes any more decisions, rather than wait till afterwards and find out that they did it wrong. So if you have interest in having that kind of I wouldn't call it a structured process, but a more a little bit more of a formal process of communicating with the primary attorneys who write this stuff for the public health official. And you just want to make sure that you have the channels of communication to get your best practices and your best thoughts there as to how to proceed. By all means, I'm available. I suspect, I don't want to put words in Supervisor Wasserman's mouth, but he's available. You know, that's a role that the supervisors can play, and pretty darn effectively when it comes right down to it. So I just want to make that offer to you all as you continue. I know you have slides to go through and you have a lot of work to do tonight, but as you're thinking, well, what do we do with this stuff? It doesn't just have to go to the state level. In fact, it may almost be more effective to bring it through the process at the county level, you know, if you do it the right way. Thank you for the opportunity to say a few words. I appreciate it very much. And thank you for letting me be here.
Thanks for being here, Dave. And you made some great points. I want to go next to Mike, but I want to follow up on your comments is that we found it difficult to have good communication with the public health department right now. Totally understand. Well, they got so much going on that they've had to overcome. But as we try to navigate our ways back into our practice, we would really appreciate the opportunity to tell you what our thoughts are. If you have staff or yourself on the call tonight, you'll see the things that we're considering and preparing so we can go back safely. Let's next go to Mike Wasserman. Mike, you want to say a few words?
Thank you. Thank you, I would. And it's good to see my fellow supervisor Dave there. And I'm glad you don't have three of us on, because otherwise we couldn't be talking. I also want to thank Will for inviting me to this. I'll be relatively brief. What Dave said, I agree with 100%. For over 3 weeks, I've been advocating, as I'm certain he has, to reopen our economy. I've stressed over and over and over again, we were having a housing crisis, and we came along with a medical crisis, and now we've got an economic crisis. And frankly, the last two, economic and medical, are a pandemic. They're worldwide. That's what's going on. Dave and I both have business backgrounds, and I'm trying to disconnect the medical from the economic. I'm trying to find a way in which our businesses can reopen sooner than later, because we're in a recession, we're headed towards a depression. Every single day, as Dave said, I know he is, we are in communication with the public health office. I'm going to hold this up in front of the screen for a minute. The top two numbers, let's see if that shows there. The top one is supervisorwasserman.org. You can go to my website and every link that you need is there. Or for businesses, there's a special email address for businesses. There's one for businesses, there's one for elected officials, and there's one for the general public. So coming from a business perspective, I'll hold it up there. It's the second one. It's CBO liaison at eoc.scc.gov. And any of you that are trying to write that down, or any of you that are trying to look at it, just take your camera out and take a picture of that screen and blow it up later. But once again, it is CBO, as in Charlie Baker Oliver, liaison, LIAISON, at EOC, as in Edward Oliver Charlie, .scc.gov.org. That's the way you can get your email to our PHO, Public Health Office, our EOC, Emergency Operations Center, our liaison that is there specifically to handle emails from businesses. That's your most efficient way to get through. We've been at this for 46 days, I think. I've spent 46 consecutive days, no less than 12 hours a day, addressing the more than 10,000 emails I've received. And I'm sure my fellow supervisors have received the same amount or more over the last 7 weeks. My emphasis now, and I was happy with yesterday, it was the beginning. It was a step in the right direction, but we have many more steps to go. And while they were talking about that order being in place for a month, personally, I'm hoping it's not in place for more than 2 weeks. Personally, I'm hoping that in 2 weeks, they look at the number of new cases we have at the hospital, the number of new cases that require hospitalization, and say, okay, we're doing okay. We've got the capacity, we have the beds, we have the personnel, we have the PPE, personal protective equipment. We can handle this. Let's release, let's free some more businesses and monitor that. And my personal non-medical opinion, and I realize I'm speaking to 500 doctors, is okay, if our hospital occupancy increases up to say, let's say 75%, then we need to slow the roll, slow the release of businesses. But if it doesn't, let's release some more businesses. The reality is, while we've done 25,000 tests and 2,000 of them have tested positive, we've been testing people that were felt to have COVID symptoms. So yes, our percentage of people being testing positive is high because almost all of them are referrals from doctors saying you have COVID symptoms. The more people we test, the more people will test positive. So this outcry, in my opinion, for test, we know what it's going to test. When you've tested 25,000 people that seem to have symptoms, and you have the 2,000 people that do, 1 out of 10, which is what it's been from the very beginning, and 109 people that have died, that's a pretty darn good sample size. People that are saying, test. Well, we could test everybody tomorrow, 2 million people. And probably, some small percentage would have it, but then the next day somebody could get it. And we can't test everybody every day. So what I'm lobbying for, what I'm advocating for as a small businessman for 35 years is that we open our economy up, and yesterday was a good first step. The construction industry is huge. Building housing is huge. My poor gardener, self-employed, Schedule C, can't get unemployment, doesn't get a W-2. He's out there mowing and blowing 50 feet away from anybody with a mask on, and he hasn't been able to work for the last 6 weeks. Lots of friends, self-employed, unable to work. I got this information, this contact from Will just the other day, and he told me about the confusion that exists on your ability to return to work, people to go to see you, what procedures you can perform. So I called up our county council. Dave and I have better access than you to our administration because they all work for us. And before I tell you what he said, Dave's point is extremely important. The public health official is appointed and has this power. In the 10 years that I've been there, I've never seen her power used. When I heard people speak before, they've never seen it used. I've learned more about COVID. I've learned more about the public health office, what her powers are, what the state public health office is, what the governor's is, what the president's isn't. I've learned more about this in the last 6 weeks than I knew in my whole life. I'm sure all of you have too. And the reason being is that we don't have economic and medical pandemics hit often, thank God. But when we release people, unless they've had it, they can get it. So the purpose for the shelter in place was to slow the roll, slow the spread, slow the impact on our hospital system. And I don't know if all you dentists know or not, but Santa Clara County's medical system is the 3rd largest in the nation. And we were heading towards maxing out. We were heading towards setting MASH units, tents, out in front of Valley Medical Center on Bascom. We had a federal facility come in and set up at Santa Clara Convention Center with 250 beds. I think they've got about 10 people there now. We had a ship dock off our coast. I don't believe we have anybody there. But because we sheltered in place, we slowed the spread. We got the equipment. We're prepared now. And if there's a surge, if there's more increase, we'll be able to handle it to a certain limit. That's why I feel we need to release more and more businesses each week or every other week. All of that said, I contacted the doctor after Will contacted me yesterday. Excuse me, I contacted our county council after Will contacted me yesterday with the confusion about I'm a medical provider. Am I allowed to remain open for preventative and non-urgent? The answer was yes. The next question was, I run a dental facility. Should I continue to provide cleanings and non-urgent dental services? The answer was no. So I contacted our county council, and this is the simple one-sentence answer. I said to James, are dentists allowed to provide regular, e.g., cleaning services? He said, Mike, the order does not, in capital N-O-T, require dentists to shut down for any services, period. Excuse me, it's two sentences. However, comma, the recommendation for dentists is to avoid non-urgent care because they, meaning the dental industry, appear to be a very high-risk occupation for getting COVID. So again, the order, which came out yesterday, takes effect on Monday, does not require dentists to shut down for any services. However, the recommendation for dentists is to avoid non-urgent care because they appear to be a very high-risk occupation for getting COVID. As Dave said, each industry has sent us their implementation plan, their reopening plan. Some were hundreds of pages. Some were best practices from tennis clubs, swim clubs, golf courses, the construction industry. I assume your dental association has done or is doing the same thing. But I wanted to respond directly to the question that Will asked me. I told him I could be on this recording from 5 to 5:30. I'm sorry if I've used up more time than my allotted, President Ken, but I think the point that I brought home here is an important one. Thank you.
Thank you very much, Mike. We sure appreciate that. And your point was right on point. This is the question that we've all been asking. I think it's a responsibility really for dentistry right now, after hearing what you just said, to make sure that those of us who are anxious to go back to work are doing it properly. We need to protect our patients, our staff, and we need to protect the reputation of our profession. If we have another outbreak and it's traced to dental offices, that's not going to look good for us. So that's one of the things we're going to talk about tonight. I don't want to open it up to questions to the two of you right now, just because we have so much more important stuff, additional important stuff to go over tonight, and I want to move on with our meeting. But thank you very much, both of you, for being here tonight, and stay on as long as you can.
Thank you.
Thank you.
Okay, well, now let's get to tonight's content. Here's a picture of what we're going to teach you how to do tonight. Getting ready for your return to practice. You can see what Nima's going to show you and all the requirements. This is a joke. You're not going to have to do all this. We're trying to keep it lighthearted. As you guys know, we're all a bunch of colleagues, we're neighbors, we're friends, and we're here to help each other get through this crisis. So as I've said the last couple of nights, sit back, get your questions ready, and enjoy sharing some time with your colleagues. Let's go to the next slide. We do need to give you a little disclaimer, and I will just tell you again, this is content that's provided for informational purposes only. It's not a substitute for legal or financial services that should be provided from a licensed professional. Let's go on to the next slide here if we could. So we're going to introduce next the chair of one of our subcommittees, Dr. Robert Shorey. Robert was jumping on this stuff from day one, and he called me the very first day, I think, and we talked about getting testing in our offices. He thought that was critical, and as things have evolved, he just researches like crazy. I don't think the guy's gotten much sleep in the last month. Robert is an excellent presenter. I think he's going to share you some stuff that hopefully won't scare you, but will help you feel confident at the end of the presentation. And Robert, let me turn it over to you, and thank you for all your work you've done.
Thank you, Ken. Supervisor Wasserman and Supervisor Cortese, I'm glad you're here this evening. I know you can't stay for the whole thing, but since you told me you have email available, I have some things I'd like to send you about testing. I am in agreement with your position on that, but I think dentistry has a unique perspective on what testing means for us. So let me continue on from there, but I'll preempt so you know that I'm going to be emailing you. If you look to the bottom of this slide, you're going to see that there's a couple resources here. And these QR codes you can just flash with your camera or with your cell phone camera, and you'll see there's a link to the DHS technology and science. And there's also another resource here from IMCRIT. And so the latest information on what we know and what we don't know about COVID-19 and the SARS-CoV-2 virus is present on that site. Now, nothing like this has happened in our lifetimes. This really is a historic event. It will mark our lives, our lifelines, and we'll refer back to this as we talk to other people in our life. But I think there's a lot of positives that can come out of this. This is a time that we can reassess our lives. For me, it's an introspective time. For a lot of us, it's time to be with our families. I just was newly married last year, and my wife and I have been spending 40-something days together. So we're finding out that we actually do get along. But, you know, for some of us, we realize our kids grow up quickly. You're going to have time to spend with your children here. And so, you know, on the positive side, think about that and cherish that side of this equation. It's a time for us to build a stronger team with our coworkers, and it's a time to show what kind of leaders we are. We can increase our effectiveness in our practice, and we can incorporate some new technologies like telemedicine. But to keep it positive, I know that some of the topics we're going to cover tonight are going to be bothersome to some people, but just remember, think positively. You know, you only need to incorporate what you can incorporate. Don't dwell on what you can't do. So dwell on the positive, what we can do, what we can do to upgrade our practices. And if there's something, not all of us are going to go out and remodel our whole dental office. I understand that. So during this presentation, even though some of these things might bother you, remember that we're giving you this information so you can decide what to do with it.
Nima?
You have to unmute. You're muted, Nima.
Thank you so much. Technical difficulties. I do apologize. Good evening, everyone. Thank you for joining us. Just a quick little image of what we saw basically blasted all over the news a few days ago, showing us what nurses are holding up and with regards to PPEs and what they have and what they would, you know, they're desiring. But you know, most people don't realize, as the two other gentlemen have stated, that, you know, we're at the front lines and we're at high risk, and there's lots of data for that. And this is the data that's coming from the CDC, that approximately 11% of all the known COVID cases are actually healthcare workers. And thus far, 21,000, almost 22,000 people have contracted COVID, and 71 people have died. And this is because we're in this high risk field. Next slide. This just gives you, shows you what some people are actually the levels that they're going in terms of PPE, right? So on the right side, we've got, these are just residents at the dental school doing routine extractions. This is what they're required to do in the state of Pennsylvania, okay? And on the right side, we have an anesthesiologist in Kaiser. This is how they're supposed to dress with regards to intubations and such. So we're not really the only ones that are requiring these types of things and making these types of recommendations. This is on the medical side as well.
Robert?
The main thing with this situation, I found out all the way back January 11th. I happen to have a friend who works for Cepheid. He's the chief medical officer, and he's a consultant to the CDC. And he, in our wine tasting party, he was telling me about this virus they were concerned about. And the particular concern was that there were asymptomatic carriers. And so there are people roaming around our society and neighborhoods, and they're touching things and coughing and doing things. And then you touch those surfaces. And we find that the velocity of infection of this virus is high. And so that's a concern to us. In dentistry, particularly, we're concerned about dental aerosols. And we know that from science that these aerosols can hang around in the air in our rooms for 3 hours. We don't know with this virus what the viral load is. You know, what's the percentage of virus does it take to really get you to be sick? But what we do know is that for 24 to 72 hours, there are surfaces around the office and areas of your home and car and so forth that this virus can live on. If you look below, there's also a little QR code again, which will lead you to some other research information. The the main concern about this virus is the aerosolization. And I think you can imagine that's got our name all over it as dentists. We want to be able to keep a tooth healthy when we're grinding on it. And so we do that by spraying water on it, and that water spray ends up going into our room. As Nima mentioned, healthcare workers are the second highest group to get infected. We would like to think that we're going to have a vaccine in 18 months, and we all pray that that will be the end result. But we don't know for sure. We don't have a vaccine yet. And currently, there's not enough testing. Now, I'm going to talk about the ins and outs of testing here later on in our presentation. It's really important that all of us dentists understand that, and I want to share that information with our representatives as well, so that they can get a perspective from us exactly why I might believe testing is the right thing for dentistry, for my office. You know, all the current testing methods that we have, we're aiming to have testing methods that are 5 to 15 minutes, and the faster they are, the more likely there's going to be some error. The most accurate tests take 45 minutes, but all of these tests are on-site tests. One of the things we want to share with our colleagues is that as we're talking to patients over the phones, checking on their health, inviting them to come back to our office, we want to do a little preview. But loss of sense of smell is one of the first things that has been reported to happen. There's scientific reason for that. That virus can enter in through the olfactory process, and that's the beginning of their infection. We look for things, we'll be testing patients, looking at their temperature, dry cough, shortness of breath, these kind of things. Unmute.
So as we look at this news, this other slide, we are seeing the emergency department, and by no means are these the patients that are going to show up in your office. But it's good to keep in mind what symptoms they might be exhibiting, such as, you know, trouble breathing or persistent pain or pressure in their chest, any bluish tinges on their lips or on their faces. And then the other issue, which is related to hypoxia of the brain, is the confusion that might set in, and folks might appear like they're having stroke symptoms, or you might be unable to arouse them. These are definitely the people who will need to seek emergency care in the hospital right away. What else do we know? We know by listening on to all the information that we are getting through all the different channels, certainly through ADA, CDA, CDC, and the news, who are those folks in the community that are the highest risk of getting the COVID infection. And those are the ones who are people who are over 65 years old, and the ones who have comorbidities such as obesity, or heart disease, or diabetes. They might be the ones who have chronic lung diseases such as chronic asthma, or the ones who are immunocompromised, might be seeking treatment for cancer, folks who might be needing dialysis because of chronic kidney disease, and certainly those that have altered liver function and liver disease.
Sorry, guys, I want to talk about testing, and I think we should know about the different types of tests available. We do need some background. There are resources out there right now down in Southern California trying to sell dentist testing kits. And those specific testing kits are what we call antibody or antigen testing kits, serology kits. That is not the type of kit that we want for dentistry. That's what people who determine infection rates and our public health servants, they're more interested in that type of data. What we want is we want a test that will tell us when a patient comes to our door and wants to be invited back into our operatories, are they carrying a virus that could contaminate our office and infect our staff and other patients or not? And that's what PCR rapid RNA testing does. And that's what I want to also share with our representatives. This is the test that dentists need and want, and we want the ability to do it, and it will help our communities. And they're exactly right. If people leave our office, they could later go out and get infected. But when I invite them in to go back to the back room, we will have tested them, assured that they're not going to infect others, and invite them into our office. That's how we keep our offices clean. Otherwise, we have to get into these suits to the nth degree to protect people. So testing, PCR rapid testing, will allow us to practice at the standards that we've been used to. There's one other test called saliva testing that's a rather new test developed by Rutgers University. I'm not going to speak much about that, but the main thing, is key word here is saliva test. If they ever make that so that it can be mass produced and used, well, that's an easy test for dentists. Our patients spit all the time. But of the groups, we know the most about the mouth, the oral pharynx, and these things. We would be well qualified to do testing within our own offices.
So there's a lot of bad news that's coming our way, and we're all feeling very down and negative about the situation that we are in right now. But there are certain things which you can do now. What can you do? I think it's important to stay healthy. It's very important that we stay healthy so that we are getting enough rest and enough exercise. And so when we do have the time, when we are ready to go back to work, we are at the best of our abilities. The other thing that we can do, and we should all look into this, is we should all be thinking about a new business plan, perhaps. How are we going to make up for all the loss in revenue, the productivity that, we're not seeing patients for the last so many weeks? And what do we do about that? So this is the time when you can take time to actually look at what adjustments you might need to make for your employees. Who are your key employees? What are their schedules going to look like? Perhaps you need to add more days to your practice, or perhaps you need to extend your practice hours so that you are able to see those additional patients so that you can stay afloat. And talk to your office staff, maybe conduct office rehearsals to figure out what is going to be the patient flow, the certain ergonomic changes that you might need to do. How is safe social distancing going to be practiced within staff and with patients?
Excuse me, Robert. Mike Wasserman.
Go ahead, Mike.
Yes, I'm sorry to interrupt. I've gone beyond where I was supposed to do, but I needed to leave. I just want to say how impressed I am with all that you have done and what you're doing, and how the dental industry obviously is concerned about the well-being of the community and your staff. I think this is absolutely phenomenal what you've done so far. I assume, like I said, you have submitted a plan as far as that goes, and I will continue to lobby for businesses such as yours to be able to resume normally without so much concern, can we not, hanging over your heads, so that your patients can get the quality, excellent, needed medical care they need from you on a regular basis. I love my dentist, and I just thank you for doing this. I wish I saw much more of this from countless other industries. Other people just want the doors open, let people come in. We'll turn our head when we sneeze. And you guys are going to the nth degree. And I really, really appreciate it. And I will pass on what I'm seeing. I've taken some photographs, not of the very first slide of what your dental office should look like, but the other ones.
Thank you.
And yes, absolutely. And congratulations on your marriage, Robert.
Thank you.
Take care, everybody.
Thank you
Thank
so
you,
much,
Mike.
Mike.
Thanks
Thank
for
you
being
for
here.
your time. Thanks for being here.
Mike, thank you
Stay,
for
stay healthy.
notice coming in.
Thank you, Mike. Thank you for joining us. It was important to us.
Stay well.
Thanks, you
Thank
too.
you. You too.
All right, so moving on, it was great to hear what Supervisor Wasserman just said. And I think, so keeping in mind, what happens when we come back, and I'm hoping that is soon enough that we can all start seeing our patients, but this is the time to keep our patients informed. What are the latest developments and the upgrades? What are we doing in our own offices to keep them safe? To let them know that their safety is of utmost importance to us. Maybe sending them a letter. ADA has an excellent toolkit that you can use, sample letters and so forth. Use that, talk to your staff, talk to patients about when they would make appointments with your office, how important it would be to keep keep their appointment time and be on time, because remember we talked about spacing appointments, and it would be important to give them your full attention during the time that you have set aside for them. How do you schedule patients who are over 65 years, or maybe the ones who have those comorbidities? Remember, these patients are already exist in your practice, and it's important for us to let our patients know that, hey, we care about you. That's what it's going to set us apart, to let our patients know. And then, update your medical history, patient's medical history over the phone, perhaps, before they come in, instead of waiting for that to happen once they arrive in your office. The other thing to let patients know is about, things that you would do on a daily basis, taking your own temperature, your staff temperature, perhaps even posting it in your office somewhere, just so that they know that, you've already screened your staff, you've screened yourself, you checked yourself, and made sure that you are not symptomatic, so that when the patients do come in, they feel comfortable that they can come into your office and be seen in a safe environment. Obviously, the patients who come in will be screened, their temperature will be taken, perhaps providing masks and gloves. If you're going to have someone wait in your waiting areas, it would be highly important not to schedule multiple patients at the same time, preferably only one patient. Stagger those patients, space those appointments out, would be important to prevent that cross-contamination from happening. And then, of course, your staff and yourself. I mean, this is a difficult time, as I mentioned before. We are all emotionally drained because of all the stressors that are coming at us from everywhere. And it's important to keep us grounded, keep us staff grounded, keep everybody positive. Certainly you have support. Dr. Nilofar Zarkesh had mentioned that on the first day, if you had joined us, talking about how to manage the stress. We are here for you. This task force was started keeping our members in mind. What can we do for our members? How can we support our members in this time of crisis, in a global pandemic? How can we help you? What can we do for you? And so, talking to supervisors, talking to public health, talking to the state dental director, doing all of these things collectively, so that when we all go back to practice, we feel that we are comfortable and safe in what we do, and to help our patients. So reach out for that support, reach out to your dental society, to your peers, to your friends, use Zoom, use Google Hangouts. There's multiple platforms that you can use, so that, you feel like you're supported. And then the most important thing, of course, is to make sure your staff, you screen them, you talk to them, and ideally your staff does not have contact with anybody who's either tested positive or who's exhibiting symptoms, or your staff is not exhibiting symptoms themselves. And if so, have those contingencies in place so that you can plan ahead of time if you need to have somebody else to fill in. Keeping the same thing, logging your staff temperatures and so forth. Robert mentioned the testing, when enough tests are available, conducting those tests, or perhaps having a certificate of health coming in from the physician's office saying, hey, yes, you're negative and you're safe to either provide the service or for a patient to come in and get to the dental service as needed. The other important thing is, we are all used to, especially I'm guilty of this myself, women, we tend to carry multiple things with us in the offices, your purse, your lunch bag, another, maybe a book or whatever. Try to minimize those things so that you have fewer things that might pose a risk of getting contaminated, and you bring them back to your family. Reduce the congregations at break rooms, during lunch times, perhaps, when, just talking about those things now and having a plan in action for when we do come back is important.
Go on.
So,
Dr.
Getting back to what are some of the requirements for all of us to get back safely to work. We want to realize it's a team effort. So, our staff are like family members. The last thing I would want is to have one of my staff members or even my patients or somebody to get sick. So, you know, a lot of these things are, you know, we're all in the same boat. We're trying to protect everybody and our staff and loved ones. But, you know, that's how you got to think about this a bit, because there's a lot of unknowns. It's a novel virus. That's why it's called a novel. And so we have to really go based on some of the data that's coming out from China, from Italy, France, the European countries, and try to see what they saw with this virus, because again, we came after that. So we want to make sure that we're going over with our staff in terms of rehearsing and taking on and off the PPEs, review the changes within the office in terms of flow, because we want to make sure that patients are not crossing paths. So whoever's coming in, checking in is basically kept separate from somebody that might be exiting the office, maybe through a back door or something. If there is space, that there is a recommendation to designate a room that's basically going to become your decontamination room, where you're going to be able to put on and take off your PPE equipment. And again, all of this is to minimize the transmission of the virus. And again, this is a team effort, because one weak link in that wheel can basically expose everybody on that team. So we need to make sure that you guys are doing morning huddles, going over the protocols and all that stuff, because everybody's got to be able to do all the same precautions. This is readily available. And again, all the QR codes, you guys, hopefully you guys have the app, so you can go ahead and scan these. And please review all of these when you have some time yourself, with your staff, multiple times. It just goes over a step-by-step, you know, fashion. How do we put all of this equipment on? And a good way to remember it is that the way you're putting it on is almost exactly backwards on how you take things off, okay? So we initially are always going to start off with the gowns. And again, make sure that you're using a gown that's basically, it's what we call isolation gowns. So the gowns that we typically use in dentistry, which is breathable and doesn't get hot, those are really not things that are applicable for this type of environment that we're in right now. So you need to make sure that it's something that's basically an isolation gown that's resistant to fluids. But you put that on first, and then you put on your respirator, ideally, again, an N95 if you guys have it. Next slide. Then after that, you put the protective eye gear, because again, lots and lots of papers, especially from Italy, that just came out, that you know, ophthalmologists were getting basically infected because of the eyes were not protected. So we need to make sure we protect the eyes. So whether if it's a goggle or a face shield, does not need to have to be both, one or the other. And then lastly, we put gloves on. And the gloves, even though that there's been lots of reports about double gloving and triple gloving, it really comes down to how comfortable we are in terms of how to take these protective gear on and off. The advantage of having multiple layers of gloving is that it's basically an additional layer of protection when you're taking things off, okay? So again, getting to the taking off portion of the PPE equipment, there's really two methods that are presented here. One method is assuming that you're going to be just basically chucking everything and it's one-time use only. And then there's another method where you're thinking about basically planning on reusing it, right? So this method here, we basically take the glove off first, one hand at a time. Then again, in the reverse order, we remove the goggles and the face shield. Next slide. And then the gown itself. And then again, depending on what type of equipment you have, then you either have to decontaminate it, and then obviously always wash your hands or with sanitizer or something afterwards. Next slide. The next method is, if you decide that you just have disposable gowns, you don't need it, you're just going to chuck everything, that you don't separately remove the gloves, you remove everything all at one time. So basically to remove the gown from the back, you pull it with the gloves and you just bunch it up and throw it into trash. And then we go on with taking off the goggles and the respirators and so on. And again, we wash our hands and sanitize afterwards. One of the methods of, again, minimizing the number of times we're seeing patients, because again, every time a patient comes in, you can get exposed by an asymptomatic patient, or they can get exposed in the office because of aerosolization. So what most people are recommending is almost using teledentistry or telehealth. And before patients come in, we're going to start pre-screening them. So ADA has provided a toolkit, and there's going to be a form in there that all of you guys can get from ADA that literally asks your front office to ask pointed questions to try to screen out patients basically before they come in. And this can be accomplished via phone call, text messaging, emailing. And at the same time, sometimes people, what they're doing is even providing with consent forms and other things that are specific to COVID-19. So I'm not sure if you guys know that, but there are specific consent signs that are required to be signed before patients come in and are seen or have any procedures done. So make sure you guys check with your malpractice carrier.
Thanks, Nima. Shakopi?
Unmute.
I'm going to run through these next few slides real fast, just because I know we want to leave time for Q&A. Just a couple things to point out. There are posters through CDC and the California Department of Public Health. There are links in this workbook that you can use to find those posters. You need to post those outside and inside your office building. Also, removing all high touch, high contact items from the reception areas would be important to, again, prevent that contamination between patients. And then, as Nima mentioned, using teledentistry, a lot of teledentistry codes are now reimbursed through your insurance. So just make use of that. Perhaps those post-op visits that you would have with your patients routinely in the office you might want to do those through either phone or through video conferencing. And again, we all perform purging and office infection control and universal precautions. That all still remains in place. So I don't think I need to go over that too much. Some of the stuff, like maybe, if you haven't been to your office for a few weeks, go in and maybe, dust it off or move furniture around, or think about how you're going to visually, look at it and figure out how's the patient flow going to be, where are the touch points, those type of things you can still do now. You can go and look at your office and look at it from a different lens now, that when you do open up, you're going to have to keep these things in mind. So just keeping in mind those as well.
Nima?
Unmute.
Got it. So again, as I mentioned earlier, a lot of the recommendations that we're suggesting are coming from the scientific papers that are coming out from China and Europe. And this one that just came out recently from China and published in Emerging Infectious Disease found that, in hospital wards, that the virus is actually found much further than you would expect, much more that we have been actually telling people too, that in this paper, they actually looked at it in about 4 meters or 13 feet away. They were able to find the virus on air vents. Again, how did the virus get into the air vent? Because again, it's aerosolized. Doctors' offices and all sorts of other areas. So this thing, it spreads. And what also people don't realize is that you have to look at the virality of this virus. It is, they have what they call an R number, or how infectious a disease is. This thing is about what they say 2.8 or 2.9 R, where the Spanish flu of 1918 was 2.0. So this thing is a lot more contagious, and it moves much faster than the 1918 virus. Next slide. In the same study, they looked at everything. They basically swabbed everything in the hospital ward after they discovered that they had 2 patients that were positive with COVID. And it was in the computer mouse and trash cans, had bed rails. They're basically all over the place. They didn't look at keyboards, interestingly enough. I don't know what type of computer that is, but they did find on their mouse.
Well, as we mentioned, this is the time to go into your office and look around, look at the physical plant of your office. We all have different styles of offices. Some are way open. Think of an ortho office. Some of us like the open plan where there's just a single divider, but the rooms are, open to each other. Some of us have individual rooms. Some of us have carpet. Some have wood floor. Some have linoleum. So go into your own office, take a look at it. Most of us will have central air. We'll have a exhaust air coming in to cool the place down, and an intake air to pull it up to the central unit, and all those germs are going up to the same place. So we do have to do something to mitigate that. In my office, you'll see that white canister they have there. We bought several of those. I've got one sitting over here. It's kind of a monster. Anyway, we have those in each operatory. It has a sensor on it. It looks at the particles in the air, and it changes speeds according to that. There are other companies, Pico, Molecule, several where you can get medically approved units. But what we want in common with these air purifiers is that they've got UV light, they've got a HEPA and charcoal filter. So whatever it sucks into it, the UV light should kill it. And then you have that exhaust or intake manifold up in the ceiling. This is one way one office might deal with it. Another way would be to get a UV light, build a baffle around it so a person's not laying in the chair looking at the light. and hook that up. And as air is being drawn into it, it's going by there. Now, if you have the ability, you can get more sophisticated and create a negative pressure room. And we know people in our community that have done that, and you can get that information. Jeremy Ueno would be one. Nima is also doing that in his office. If you look down below, interesting, I saw this on Jeremy's webinar, the surgically clean air. It's a solicitation, of course, but I think it's a very interesting study to show you what dental offices are all about. We are designated as one of the high-risk groups. Just downloaded today OSHA's latest finding, and we should get that information and read it and use that information to do what we feel is necessary to make our offices safe. So just remember, we can't deny that we are designated by a regulatory source, OSHA, Cal OSHA, as a high-risk generator of aerosols. So we need to at least try to do something about it until they come out with surefire regulations so we know what to do about it. And this slide is really the same comment, so I'm going to let you continue on so we can get through here and get to questions. Overall, when we are back in practice, we should rebuild our teams, our teamwork, get together, take temperatures, log those temperatures, track who's chair siding with what patients. We don't want any patient to show up and have this, but it may happen. And they're going to come to your office and want to find out, look at a trail. So all this tracking stuff is likely the future. And it'd be good to know who was with that patient during the procedure. Make sure to review all our infection control measures and make sure that the materials that you're using are approved for the proper disinfection and sanitation.
Nima?
Again, I'm sure you guys have seen this. We went over this the other day on Tuesday. This is basically the latest recommendations from the ADA, the interim guidance, basically. And again, on the top is basically N95. Second to that is KN95 and the surgical masks. Again, this goes into more detail. And again, the N95 is the only one that's NIOSH approved per the requirements. And I know there's been a lot of debate with regards to, how effective, how much more effective or protective are the N95 versus the surgical mask. And there was a research paper that just got published from Korea looking at this exact thing. And it's actually twice as more effective as keeping out viruses. Again, N95s are designed to keep out viruses. Surgical masks are not. There's many counterfeits out there. I literally just got this in the mail. I got a whole bag of these guys. I've never even ordered these things, okay? I went online and looked on CDC. Of course, it's not on there. And who knows how these things are basically certified. So CDC has provided great information on their website with regards to how to find out who the counterfeits are and what numbers and other things to look for. Next slide. Double masking. So in order, because again, remember, before all of this, N95 masks, all masks are one-time use only, but now because they're so scarce, people are trying to double mask, putting a surgical mask on top of an N95 to try to conserve them. But there's some debate that may actually interfere with the flow mechanism in a mask. So we are recommending, next slide, that if you're going to be double masking, please do not double mask on top of an N95 that has a valve in it. Use one that's a complete solid one. Again, in summary, in an ideal world, we would love to have everybody, even the front office, wear an N95. Again, they're our family members. We want to protect them. Clinical staff, where there is what we call high-risk procedures, right? Using high-speed drills, cavitrons, and other things, where there's much higher levels of aerosolization, we want to use other protective gear on top of N95, which is going to be the goggles or face shields, gowns, hair covers and shoe covers and so forth. Again, practice please doing this beforehand, because I found out and one of my partners asked me, hey, can I use a loop? How am I going to put my loop on? This is the time to figure all of these things out. How am I going to put my light on? You don't want to be doing this on the day we have patients showing up. So please make sure you guys are doing this beforehand. And again, just a reminder, every time you put an N95 on, you're supposed to be doing a seal check. And there's a great video online. So every time you're putting it on, you're supposed to be basically clipping the nose and doing a fit test. So please watch that video.
Before we move on, I want to quickly remind everyone that in the next few slides, we're going to have a lot of these QR codes, so get your phone cameras ready.
Again, another way to figure out, hey, how many N95s do I need? I have referrals texting me. I only have 5. I only have 10. How am I going to survive? We're going to go through all of that later. There's what they call a mask rotation. You can, at least based on CDC's protocols, you can use them at least 5 times and decontaminate them. And there's some studies that even show up to 20 times. So we will go through all of that. But please make sure you guys take photos of all these QR codes, because there's a lot of relevant information with regards to what we're going to be talking about more in detail. Next slide. A great one here is the last one, which is what we call the OSAP, the Organization for Safety, Asepsis, and Prevention. This is a great website that I actually got from the Minnesota Board of Dentistry. This is like the mother lode. If you guys go on there, it has tons of information for all of you, people that want, citations and papers and stuff. That was a really great website. Again, so we want to make sure we minimize the number of times patients are coming in. So if you have not done this already, through your website, try to create forms that are fillable for pre-registration through Adobe Stack Forms, which is another company that does a lot of this. We want to try to minimize the amount of time that patients are sitting in the office filling out forms. This is not the time and environment we want people sitting there. All of this now with technology, DocuSigns and other stuff can all be done at home. Again, we want to make sure that patients are exiting in a different direction, not through the waiting area. Make sure you guys leave plenty of time for seeing patients, decontaminating, taking all these equipment off. Again, the days of doing 50 to 60 patients a day maybe temporarily put on hold until we get beyond this. We may have to maybe see, half of those number of patients just to give your staff enough time, because remember the stress that is on top of them as well about all of this. So we need to make sure that we're not rushing through the day, and that's how contaminations occurs, when we're rushing. Providing hand sanitizers to everybody, your staff, as soon as a patient walks in, wash their hands, sanitize. And I've actually figured out a great way of taking the soap dispensers and actually converting them into a hand sanitizer. And I can go over all that with you guys next time when we meet.
So this is just a recurring theme. Make sure to feel out in your mind the flow of patients coming in and going out. Some things that we might be accustomed to in a pediatric office, you might be used to the parent coming back to the back, but we want to discourage that. We like you got to get permission to do certain procedures from guardians, but you want them really to stay in their car. It's summertime, they have to stay in the reception room. Well, then masks and gloves on those people who are in the reception room. You have to have somebody in charge of taking care of that environment out there after they leave. Some of our elderly, I know at times patients will roll in their mother in a wheelchair. You'll have to have your staff prepared to help them to get in and out of that wheelchair and into the dental chair and get them in and out of the office safely, with the minimum of risk. Keep all traffic areas clean throughout the day. So you almost have to assign somebody to do that, but that's a good reason also to have your front staff in the same clothing, because they can easily then go out and disinfect and clean the area and then change their outfits. And again, we're promoting teledentistry. That means it might be your iPhone, smartphone. It might be an actual agency hired to do these things, but try to do some of these things so that we keep that from happening. We were talking about this, when a patient comes in, there's going to be a bit of a change there. They'll come in, and before they're seated, they're going to wash their hands, and then they're going to rinse with peroxide. Now, there's different organizations that say 1.5% to 1%, but it's basically your brown bottle peroxide diluted, can be in half or by 1/3. A lot of times, you're going to make sure that you have the right amount of people helping out during the procedure. Less is better when it's legal. Okay, so if you're doing IV sedation in your office, you need a certain amount of people. General dentist, you might just have a one main chair side. You want to do more of quadrant dentistry now, extend the procedures and spend more time with your patients and more time on the procedures. And then dismissing the patients, we want them to exit and we want to get out of that room and into a decontamination room to get all our clothing off. So in my office, I have 5 operatories. We're going to designate one of the operatories as the decontamination room. It's important to keep a visual impression in your mind that after you've treated a tooth, you've drilled and did a crown prep, there's a cloud of aerosol in your room. And so you don't want to stay in that room and try to decontaminate. You want to get your things off in the decontamination room. So move out of that room and into the decontamination room.
And so again, a lot of this stuff is what we've been doing, you know, in terms of universal precautions and what we do to take care of a patient, disinfection, same stuff, but with a different lens is how I would like to put it. There is a URL that's put up there, and you can look at that and look into the website to see the list of the EPA recommended disinfectants. And certain things to just keep in mind. I mean, you know, Robert talked about the air filtration system. Do we, you know, we need to think about, do we need to keep the operatory vacant for some time to reduce the viral load? Do we schedule patients certain procedures during certain times of the day, or perhaps, you know, have a hygiene patients come in one day and maybe do procedures like crown and bridge, those type of things on a different day. Just keeping those things in mind now is the time to plan for all that. You know, I think that would be a positive spin on, well, we are sitting at home, twiddling our thumbs and getting stressed. Maybe this is the time, you know, focus on your business, on your practice, rather than thinking about being in your business and in your practice. I think that might be a good way to put it. And then, you know, going to high-speed suctions, using Isolite, or perhaps, you know, moving to rubber dam like we did in school. Is that what we might need to do? You know, thinking about using cavitrons and sonic scalers. I mean, how can we get around that and prevent the generation of the aerosols that those type of instruments and procedures involve? Maybe using a towel to cover up your patient's eyes and nose, so that those can be then, you know, laundered and maybe a patient would tolerate them. But all these practical things, just looking at it at a different lens now, thinking it through, using the resources, using the toolkits, and hopefully we can all go back to practice soon. I liked what Supervisor Wasserman said, but, you know, Supervisor Cortese and I have been talking for a long time about what we can do, and he's just mentioned earlier too that he's willing to work with all of us to kind of put in place a plan that we can provide to the board and they can provide to public health, so that they can work with that template and then come up with a recommendation that's coming from us, from the dentists, from people who are subject matter experts and who do this every single day. So that's a good thing. And just hang tight. We'll have time for Q&A in the end.
You know, we're all anticipating opening up, and also a lot of us are seeing our bank accounts going south. So just be aware that people are out there to help you. We have a whole group of people on this task force working on the financial questions. So use that resource. If you weren't at last night's session, call the Dental Society. They'll put you in touch with them. Use Slack. That's another app that we can use to be in touch. But there's a wealth of information. They've done a lot of research in that in the finance group. Make sure that you guys, when all of us go back to work, that you have disability policy in place. And I highly recommend formation. If you're not a member of a mutual aid group, get together, find a group of dentists that you mutually respect, and formally put together a group where if one of you falls ill, or if your practice has the misfortune of having to be quarantined, that there's a backup plan where other doctors can help keep your practice running. These mutual aid groups usually work where if you have 6 to 12 people, you just rotate one day a week helping the other doctor out, so we can help one another. And we have forms for this. You can get that. Neelafar has those forms. The Dental Society has them. But very important to consider that. Consider fallback positions. If your practice is not able to reopen, maybe you can take your patients and yourself and team up and buddy up with somebody else and practice together. So seek out your peers in the Dental Society. That's the best thing about our profession. We're usually willing to help each other. If you lose staff members, you know, we hate to lose team members, but in this environment, remember, I wouldn't let that bother you too much. You could likely hire somebody new because Nobody's going to be as busy as they were for a while, and there's going to be people who are looking for work. I talked earlier about rapid RNA testing. This is important to prevent future problems like this ever happening again. This will not be the last pandemic. This is actually the third one, but it just happened to have some unique properties. But if we had the ability to do testing within our own offices, then all we'd have to do is test people to make sure they're safe to come in and see us. And we could help the community identify who carriers are and quarantine not the healthy people like we're doing right now. We would be quarantining the sick people. Here are, again, some QR codes for resources for you. Just, again, use your phone to clip some of these QR codes. SBA, disaster assistance, probably some of you are well aware of that. California Dental Association, Santa Clara County Public Health, and some insights into PPE disinfection and so forth. All right, well, I've said this many times. I believe it is absolutely true. Dentists are some of the brightest people. We're usually, the MacGyvers of the world. We learn how to fix things and make things work and help people. And I think we're very talented. So we just got to aim our talents to getting through this thing. There are resources to take advantage of. We know that there might be desperation out there, anxiety, all kinds of emotions that are common to humankind. But we're all doing this, the saying you see on the TV and everything, we're all doing it together. But remember, more than ever, I think as dentists, we're here to work with each other and help each other.
Thank you, Robert, and all the rest of our panelists for the information you provided tonight. I would like to remind everybody again, you can download this the Back to Work Safely handout on our website, sccds.org. And now we're going to respond to your questions. So let me go ahead and start going to the Q&A section.
Hey, Nima and Shackley, you might want to unmute yourselves. And Will and any of the others that may have some input.
There's a question about any recommendations on how to float the PPE shortage and costs.
That is a great question, you guys, and all of us are dealing with that. We met with some of the regional managers, Henry Schein and TDSC. Obviously this is a challenge that all of us are looking at to deal with, but right now we have to almost with, safety first, unfortunately, and the cost for protective gear is going to be higher, in the short run, but hopefully will start to go down as the supply chain kind of starts to come back to where it was previously. But this is a concern that we've actually addressed, all the way up to CDA and also to the dental suppliers.
I want to do a shout out also to Shine. They're listening in on this conversation, and Shine and Patterson and TDSC, they're all working on this. And there's good and bad news. I mean, the bad news, if we try to buy stuff this week, we're all finding it difficult. We want to be cautious not to get into these deals where we might end up with counterfeit things. But I have a feeling that as we move forward and the hospitals aren't going to need all the supplies they got, it'll start to get back out into the market. So, do what you can do. And that's the mantra for me. Do what I can do and not let the other thing keep getting me down. Remasking is, with covers is probably the best solution right now.
Thank you, Robert. There's a question, someone's asking, how does the flow work when the assistant has to go to sterilization, sterilize the instruments, and then come back to the room and finish sterilizing and setting up, assuming that they have air purifier in place?
So you almost have to probably designate separate staff for separate duties moving forward. And that's one of the things that you might want to think through now. Who is in your staff is going to be responsible for decontamination of all those touch points, for example? Who is going to be responsible for bringing the patient in? Say, for example, we move to a model where we have patients wait in the parking lot, then who's going to be the one bringing them in? So all those type of things, I think unfortunately, like Nima mentioned and Robert mentioned earlier, the way we are used to practicing, so up until now, going from one patient to other or double booking ourselves, that probably in the near future is going to be very different until we have more answers, until we have more information about how things are with this virus and how we can help prevent ourselves and our staff from getting infected or getting sick. I think we have to all keep that in mind, that the way we do business is probably going to be very different. I saw another question on the Q&A.
Before you move on from that, I think it needs an answer. I think there are some offices that only have one assistant. And I have 2 assistants, so I know what I'm going to do. But if you only have one assistant, the quick answer is they're going to space their appointments out more.
Yeah. And then there was a question from an anonymous attendee asking about the profitability, and if we are spacing appointments and if we're seeing only one patient in an hour or hour and a half or so forth, what, how can we even stay afloat? Wish I had a crystal ball and could give you that answer, but this is the reality that the way we are moving forward, we're going to have to consider all of these points, take into consideration all of these aspects before we understand how can we move back to what we were doing a couple of months ago.
That's the purpose of the business plan, is to look at, do some rehearsals, get an idea in your mind how you can see patients. In the business plan, the main goal this year is very likely to break even. If you can break even, you've succeeded. If you've had to spend some of your savings, but you still have some reserves, you still succeeded. The worst outcome is that it ends up not being profitable at all.
Thank you. I'm going to direct the questions as we go along. So there's another question. Maybe Nima, you can take this. They're asking if you can give us a few practical ways to clean or disinfect or sterilize N95 masks. I know you briefly touched on this before, but could you provide some references?
Yeah, guys, there is a lot of data on this. There's really, again, a lot of this stuff I mentioned to you guys, CDC website, and then from there, they'll give you all the citations for all the scientific papers as to what those recommendations were based out of. So you literally, it's like, you have to just go down the chain and read everything in all those papers to really, really understand. Like they literally tell you the light source has got to be 4.5 inches from this. You have to flip the mask over. I mean, there's so much data on this. But the 4 methods that have been recommended by CDC is basically a microwave steam, it's infrared, and then basically dry autoclave or humid or like wet autoclave. Out of all of them, the one that seems to not damage the mask as much, and again, this is papers on this, I believe it was ARA that was hired by FDA to do the testing and all of this. They looked at the N95 mask, and if you use the right sequence with the UV light, that up to 20 times you can actually blast your N95s without affecting the fit. That's why that paper was so great, because it looked at how do you disinfect without actually compromising the fit of the mask, which is really critical. But yeah, there's lots of ways. Again, so if you guys just go to the CDC website, and even if you, I'm sure, Google it, you'll find this information. It's basically, I would Google decontamination of N95 masks, and then it's going to pull up a bunch of links. And again, I would only trust the government links at this point, because there's a lot of blogs and a lot of misinformation out there. Please make sure that you guys are reading the scientific backing to those recommendations.
That's a great point, Nima. Always checking the source of the information. Sorry, Robert.
Yeah, you guys can go to the 3M website also. They're the largest maker of these masks, and they specifically wrote a paper to deal with this circumstance. So they have some insights.
Someone's asking if you can quote a study that validates pre-procedural mouth rinsing as a beneficial task against COVID, because they're asking just in case my patients will question them about it.
Well,
go ahead, Nima.
There are papers on that. And actually, I think earlier when we had a meeting with Nick Nguyen, he'd mentioned actually, I think it was on their main landing page or something of the Prosthodontic Society. Robert, am I wrong? Or something like that, right?
I think so. Because he's a prosthodontist, we assume it came from his prosthodontic organization.
Yeah, so on their recommendations, that's actually one of them there. So you would imagine that, if they're recommending it, there's some science behind it. And again, so just make sure you guys realize that the Paradex that we typically have all patients use It is absolutely does nothing at all for viruses. It is not antiviral, it's antibacterial. And that's why the recommendation is for them to use at least a 1 to 1.5% hydrogen peroxide. But there are papers on it.
The activity of the peroxide is to really break the outer capsule of the virus. And the outer capsule is actually relatively weak, but peroxide is kind of a caustic material. So even metals like copper can help to deactivate that outer virus shell and disassemble it. But peroxide is the answer to this question.
Thank you. Someone's asking for recommendations for air purifier. Please go back to the slides earlier. Robert had some recommendations you can take a look at. And also asking about forms for mutual groups. We have them available. You can contact the Dental Society to get that information.
Yeah, so the mutual aid group was, forms were supplied to me by a couple of dentists from Sacramento that I was a member of their mutual aid group. The main thing about this air purification thing is this is a gray territory. So when I'm giving you advice here, you have to realize this is subjective opinion. And the issue for us is that this can range from prices that are anywhere from $250 to $2,000. So for instance, the Pico one and the Molecule, they sent us the paperwork for them, and you know, they come out of the University of Florida, one of them does, so they've had tests done, but you're going to pay a pretty hefty price. The TrueSense that I told you about, I went to Amazon, I kept reading through the specs, looking for what I felt was necessary. I looked for the square footage of my room. Remember, operatories are about 9 by 10 or 10 by 10, so 100 square feet. And so if you have an air purifier that can do 200 or 300 feet of square footage of stuff, that's probably pretty good. You need a certain amount of turnover, and you want UV light, HEPA filter, charcoal. So you want to capture these viral particles, and that they'll usually advertise if they can capture viral particles.
Thank you, Robert. And the same thing they asked about the UV light machine, which is, again, you had some recommendation on the slide, so they can refer back to.
Nima, did you want to talk more on that, on the UV light? Because you have some good insights on the, you know, not getting behind corners and.
Yeah, so guys, there are people that are going in, and because again, in the past, and one thing before I forget, remember all UV lights have mercury in them, except if they're made out of LED. So if you guys happen to just drop it, or if you break it, just remember that mercury aerosolized, it's all over the place. So there are specific guidelines from CDC how to clean up a broken UV light. You don't want to use a regular vacuum or sweep it up and stuff. So they go over that. So before I forget that, but going back to the UV light thing, they have what we call low energy and high energy. High energies are the ones that are used typically in hospital settings. In Sweden, they have a robot that literally has these towering, they're about 6 feet tall. It just roams around the hospital and the OR suites and just blasting everything. They're highly carcinogenic. Some people have advocated just putting a regular, light bulb at the ceiling and just blasting everything. But the problem is that because that light source is not moving, you get shadowing from, everything from your chair, from your equipment and other things in the room. So you're not really decontaminating the entire room. And then the other thing is it's really bad for leather material. So it's going to destroy all your chairs and other things. And then lastly, the UV lights actually degrade over time. So unless if you have a UV light meter measuring the energy coming out of that light bulb, you may not even be killing viruses. And then the other thing is the distance. So depending on the energy of light bulb, you have to be at a certain distance to kill the virus. So a lot of the papers on this, they specifically tell you, again, how far the mask or whatever you're trying to irradiate has to be from the light source. So there was a great article that actually talked about you may be better off just getting a handheld one and just moving around and just basically wanding everything around the office. But then you would have to basically cover up all your body, no skin exposed, because again, it's a carcinogen. You got to have protective, gear for your eyes because it does cause, the corneal damage. Again, a stationary UV light is really not recommended. That's what the papers say.
I think what you're getting from this conversation, it's not the first choice. It could be an additional thing to just give you a little extra boost, but yeah. It's not, the air purifier is probably more the first choice or a zero, whatever pressure room.
Yeah. And I don't know if you guys have ever noticed this, but in the operating room, most hospitals and surgery centers, they actually have a UV light, but it's facing up. and it's facing up, like either towards an air intake or a vent or something like that. It's never pointing down or at you, because again, it's not good for the eyes and everything else. So, and that's been in use for as long as I know. And that's not a new thing.
Great point, thank you. Robert, are there any current?
Speak to the mutual aid groups. So you can find the information on the ADA website. That's kind of an information mostly, but CDA has a more comprehensive one of it too. So if you go there, you can find kind of a toolkit that you can make whatever you want there too. Thank you.
Thank you for that reference.
People might wonder why they need paperwork. If you go out of your practice, and people have to have a legal right to treat your patients and to help run your business while you're out. And so this paperwork helps establish that relationship, so somebody doesn't just heist your patients from you.
Thank you. There's a question about RNA testing. I think, Robert, you can take on current. Are there any current RNA tests that are then available to perform in the dental office?
Yeah, the Abbott ID Now could perform in the dental office. Now, I came across a source, but then I was asked this question again today, and I need to go back. You know, we read so many papers, like, where did I read this? But it was said that the machine cost about $1,000. It looks like a little printer. Basically, you have to take the oral nasal swab, and you place it into a cartridge, and then you put the cartridge into what looks like a printer, and then it will give you a readout. And it takes 5 to 15 minutes for that test. So that's Abbott ID Now. You go to their website and see. Now, don't get confused, because Abbott also makes a serology test that they're marketing, but it's the Abbott ID Now Rapid PCR RNA. Cepheid also makes a unit that takes 45 minutes. That is based here in Sunnyvale, and one of the medical guys lives right here in Morgan Hill. So this technology is out there. There's Mesa Biotech is another company, and there's Qiastat, Qiastat. And those are all 4 tests that can do tests on site. You don't have to send it off to a laboratory. The paradigm in dentistry could switch to where the patient comes in to your office, they get tested. If they're clean, you invite them to the back. If they got a positive test, they might not take your word for that. They might want to be retested then, but you're not going to invite them to come and sit down in your office then. So we'll be doing a service to people. We'll be weeding out carriers from non-carriers.
Or they might get tested somewhere else and they could bring you a health check.
I wouldn't necessarily trust that. That's kind of the point of this. If somebody said, I got a card, I got tested 2 days ago, but now they went over to Walmart and they went over to this other place and touched this and that, they could be a carrier. So right. I'd like to know when I invite them to come in that they're clean. And I think my patients want to know they're clean too.
Yes, and relate to that, someone is asking, how do we, if we start now, who's responsible if a staff member or a patient claims that they got the virus from our office?
That's the big dilemma, and that's why we're having this talk here, and we're gearing ourselves up, because believe me, the news wants sensationalism, and they'd like to point the finger at somebody, and that's the truth. The person might have left your office and then gone over to Walmart and then went somewhere else, and then they picked the virus up, but they say, aha, I went to the dentist.
I think also those consent forms that were mentioned, I think by Nima earlier, those are important. I think we all should have those, and we all should be using those so that when patients come in, they're signing in consent, understanding the risks that are involved by coming and getting treatment done, even if they're coming in for an emergency.
Robert?
Yes.
But I think on that take, I think it's very important that we check and verify our workers' comp insurance regarding this, and also our insurance, liability insurance. We should call our insurance TDIC and find out about this, to make sure that we have the full coverage when we do go back. And this may happen,
I agree with you, Nick, all the way, because that's part of this planning. You have to put your mind to it. You can't think that, if they gave us a go ahead to go back to the office tomorrow, in a way, I don't want that, because I'm not quite prepared yet. That's why we're having the seminar. We need to start gearing up, getting prepared, but get our ducks in order.
And also, Robert, I think ADA, there were a series of forms that they created for us. I think that's very important, that we should post that so our member can see it as well and follow those guidelines. That was done by ADA. It was very thorough, very well done. All the forms, everything is on there. And I think that's what we use. We should use those forms and train our staff prior to finally seeing patients.
Thank
I
you,
think
Nick.
also it's important to look at your own disability coverage, in terms of what are you covered if you were to get sick.
Oh, that's why I said liability and all
Yeah,
that.
liability for yourself, yes.
For yourself.
Thank you. A lot of great points. I'm trying to race through the questions, a lot of questions coming up. Nima, can you talk about pants, the recommendation of water-resistant pants and how they can get some?
Yeah, honestly, I've been looking all over for this, and believe it or not, the veterinary suppliers have better options, or just literally rain gear. I went to Lowe's and just bought some boots for $24. But with regards to pants and headgear that's protective, I haven't been able to find much of anything. The one thing I did find, again, for all of you guys, I would recommend go to your local hardware store and just look around and see. And then this is basically, I don't know if you guys can kind of see it. There we go. So it's basically a coverall, but you can kind of see that this guy's head is covered a little bit. And then these are actually, you can reuse these things. You can put them in a washer and dryer and keep reusing them. And they're basically, fluid resistant. So besides, again, you have to be creative, because this has not been, who in the past would have to wear something that was basically, waterproof headgear. I mean,
Hey, Nima, was that Home Depot, Kelly Moore, or?
No, that was at Ace Hardware. Yeah,
right.
Ace Hardware. And what I'm seeing and what I'm realizing is that a lot of the Ace Hardware, the moms and pop shops, they actually have a lot of gear. I mean, another one I just found by chance was this little doohickey. I don't know if you guys can kind of see this. These are basically respirators that painters use. And I saw this, I was like, oh my God, this is great. But the downside to this, and my partner pointed this out, is how are you gonna put your glasses on? With this, you can't put your glasses on, you can't put your loop on, you can't put anything on. So now I gotta think about, okay, maybe I should go get contacts now, right? So, and I, again, just randomly going to, the hardware stores and just finding things. And they come as, N95, okay? And even N100, which is basically a filter that is oil proof, okay, for oil paint. So again, these are for painters, but that works basically for us as well, because we're N95, N100. So that's a great question, because I have not been able to find a great option for waterproof pants.
One of the other, this isn't about pants, but I think it's an important comment, is that, my staff was used to wearing all their scrubs into the office and wearing them home, but that's gone by the wayside now. We do have a washer and dryer, but now we got to have something for them to store their clothes. So we put an order in to get some lockers, and we're going to put that in our break area. But you got to, again, go through your mind and plan, how am I going to address some of these changes? And this is one of them. My staff will come in their street clothes, they'll change into the other clothes and put their street clothes in the locker.
Someone's asking if they have a portable room filter, where should they place it, on the head side of the patient or the feet, and how do they clean it?
That is a great question. So I have been looking at negative pressure, positive pressure. Again, there is data on this going back decades. Department of Defense, Public Health Service, the Indian Health Service, anytime they do any dental clinics, they need to have negative pressure. And so what they're saying is that you need to make sure that, just think of it as you're sucking, let's say it's negative pressure, and you're sucking the air. You want to suck that air away from your guys' faces, because that's how the viruses are going to get in. So you want to make sure that that thing is basically pulling the air from the patient away from you. So they have recommended placing it more towards the feet of the patients. Okay, so that's how you got to think of it, as the flow. You want to direct the flow of the virus, whatever's been aerosolized, away from you and your assistant's face, away from everybody.
Thank you, Nima. We are kind of past our time for this, but since there's a lot of questions, I want to ask if it's okay with our panelists to stay over maybe 5 more minutes. Is that okay with everybody, so we can answer more questions?
Sure. Until midnight.
Thank you. Okay, so they're asking, how do we decontaminate the patients after treatment? So they obviously they have all the aerosols all over the body after we're done with treatment.
I'll tell you a story. I talked to a friend in Sacramento, and he's planning to have his patients get into an outfit and then bring them back and treat. And I'm going through my mind thinking, well, what good does that do? But there's your answer. Take that outfit off and leave it behind. But, I don't know that that's an answer that's palatable to all of us. What do you think, Nima or Shackleby or Nick?
That might seem like a lot to take on. I don't see how that could be practical.
Yeah. That's the thing. A lot of the things, guys, again, because there's no strict guidelines, requirements and stuff. We just have to try to come up with a reasonable way to kind of try to reduce the risk for all of us, to the patients and to staff and everybody else. There's no way to get it to zero. That's just impossible.
I do want to say something. The State Office of Oral Health and our dental director for the state of California, Dr. Kumar, he is actually, as we speak, putting up some recommendations and guidelines for going back to work and what it might look for dental practices. And I don't know if it's going to come out next week or the following week, but I'm hoping very soon. But that's what he is working on right now in conjunction with CDA. So hopefully we should see something come up in terms of these specific logistics as to what do we do and how do we do it. But I would also strongly urge everyone who is interested, to please either through Slack, or you can email me, or through Candace, through the Dental Society, let us know if you have ideas as to what can be done, so that when Supervisor Cortese has put this forth and asked us to let him know how he can formulate this plan, and then he can get that into implementation and action, I think we can certainly play a role. And I would like to invite every member who's listening on, and please spread the word. We want this to be inclusive. We want to get as many ideas as we can, so that we can move forward quickly and in a safe way.
So quickly, they're asking if there's shoe covers that are needed, or a particular type of shoe as part of PPE. And yes, Robert, I think you can answer that.
Yeah, we listened to a webinar from Wuhan, China, and they kind of, a little light bulb went on, because they talked about wearing rubber rain boots, and Nima, I think, is also. So I went to Amazon and bought multiple rubber rain boots for my staff. I got their shoe sizes. Those can be disinfected very easily. The soles of them can be cleaned easily as well, just by having a tray that they can step into and step out of and clean off. And so rather than the shoe covers, I just think that's an easier way to, get mobile around my office without having to pull one more item off and wonder about getting contaminated by that.
And they're also asking, what do you recommend for front office clothing? What do they need to do? Or do they have to change clothing, or what protocols can they take?
Well, honestly, that is in the recommendation from the other dental societies, and I read that, I think, in the Minnesota one and other ones. So, because again, you have to think about, this virus or any bacteria is aerosolized, it's under clothing, they take it home. So they are recommending that people basically don't go home with the same stuff they're wearing at their work. And it's the same thing that, people have to do when you go into a hospital. Like if I go to the surgery center, I can't bring my own clothes and go in. I go into the locker room, I change into scrubs, and I throw the scrubs out basically, and then I put my clothes on, get out. So it's almost the same concept. So they should be really changing into, scrubs and other things. Maybe they can have a set of clothes they live at the office and change into it. I don't know, because I don't know if we want to have everybody wearing scrubs.
I think, Nima, you might agree or disagree. But, these are the areas where we're trying to think about where are the aerosols being produced and where are they not. But now we're concerned about just the whole general atmosphere of our practice. But my thoughts were, is your front staff are protected by by the headgear and mask, and they may have a gown. But I don't think personally that I would feel my staff has to change clothes between every patient that comes and goes from my office, the front office staff.
Yeah, the challenge is, like, nowadays it's all, cool to have open bay and all that stuff. This is where we now have gotten ourselves into trouble by having the open bay concept, is that now everything, the air is exchanging throughout the office. So, if you don't have some of those older buildings where each treatment room is blocked off into a room and then the front office is kept separate, this is where you can get really into trouble. And then that's where you also can't create negative and positive pressures. Like I had one of my referrals from San Francisco was asking me about this, and I remembered, I imagined her entire office is open bay. What is she going to do? Sheetrock the whole office now? That's impossible. So then that's where you have to think outside the box and think of other ways of reducing the viral load with UV lights and filtration methods and other things.
So
Thank you.
Eve Cooney, who puts up a lot of these infection control classes at CDA Care, presents events twice a year and is at UOP. She had an excellent webinar that she put up on April 24th. It is available through CDA Online Learning, and I would highly recommend, if you have the chance to look that one up, you can search it up, and you can, it's probably on ADA as well. And look into, she talks about two different methods of transmission. One is the droplets and one is the aerosols. And then she very clearly points out the differences and what precautions need to be taken. So, you know, if you haven't already done so, please look into that. And, you know, in terms of the masks and who needs to wear what, I think it would be helpful to take a look and listen to that.
Thank you. I'm going to ask two more questions. I'm sorry, Robert. I'm going to let you speak in just a moment. I'm going to ask two more questions, and then I'm going to give out the CE word this for the CE credit tonight, and go over the last remarks.
Before you move on, can you say that name again of who you were listening to?
Yes, it's Eve Cuny, C-U-N-Y. She teaches infection control at UOP. And it was on April 24th. So I believe last Friday. And it's available as a recording, actually.
Thank you.
So ADACE Online is where you can find it.
ADACE Online.
Yes.
See, we all learn even through these webinars ourselves. I didn't know about that. That's good.
Yeah.
That's great. The question about, they're asking if we open the office and somebody tests positive, a staff or a patient tests positive while we're open and in business, what is the protocol then? What should we do?
So I will tell you this. I literally just got an email from El Camino Hospital, and they've elected they're going to go start doing elective surgeries. And what they're requiring everybody is, before anybody can do any procedure, okay, is that the doctor's got to get tested. If they refuse to get tested, they can't do the surgery. All the nurses, the staff, and the patient all have to test negative before they're allowed to do a procedure. So I would say that, and again, one of the recommendations from some of the webinars that I looked at was that you need to make sure that you have your staff, basically, they have to attest that they have not been infected and then sign that form, right? So some places are recommending you actually test your staff too. So to cover yourself, I would say probably you may want to test everybody, because I have no idea where my staff are at this point. I don't know where they have been. So test them and then have them sign that basically at a station. And then if they, you know, get the virus, then you basically know, you know, what's happened. It cannot, you know, come from your office. And lastly, I would recommend you talk to your insurance carrier, you know, whatever, workers' comp or something else, because they may have specific consent forms that you may want to sign, because they're ultimately the one that's going to have to pay for that episode. So the best person to probably ask is the insurance carrier.
Robert, I want to bring this up too, is I had an emergency patient yesterday, and she didn't come in. She called and asked if I've been tested, you know, and she said her husband is a physician. Both of them have been, you know, tested. And so she said that she won't come in to see me unless I get tested and my staff. So that's something that I think that we have to start thinking about, and we need to get ourselves, you know, tested before we're going back. I think that's very critical as well.
But the question is, how often do you need to be tested? Because as we all know, you know, you can go home and get it again. So do we have to be tested every day? It's just one of those unknowns.
I would assume every time we have a patient, they got to be tested. Again, people are asking if we're going to test everybody and everybody's negative, then what is the purpose of doing all this PPE and having all these gears? And
well, I think,
and you know, the test, none of them are 100% either. So they are like, you know, there's a flaw in the test, but
I think that is the answer, Sarah. If we had point of site testing, we would not have to be as aggressive, would be the word I would use, with our PPEs. I'm not saying we'll ever fall back to where we were January 1st. We needed to do some of these upgrades. We did. I mean, when you start reading the science, we needed to do it anyway. But if we have the machines, we can fall back, and then we could probably use a a type 3 surgical mask and feel confident with a shield that that's adequate, that we're not having to do an N95. But right now we're assuming that somebody is in our practice that's a carrier, and we have to guard against that aerosol. We had a representative who's engaged in this issue, but his belief is testing this and all that critical. But he didn't understand that there's a certain perspective for dentistry. It might not be true for a construction worker or some other business, but it's very true for us inviting people back into our office, because it's going to cost patients a lot more for us to dress up in all these outfits every day than it would if we could fall back a little bit and see patients in our normal manner. Then dentistry is profitable for everybody, and the cost doesn't go up for our patients.
Thank you, Robert. And questions been asked a lot, that how do we get these tests and how do we get access to it? I think this is one of the things that we're waiting and relying on our legislators and representatives to make sure that we dentists are listed as qualified, just as the pharmacists are, to perform this test, and which is very important. And with that, I would like to close. So I would like to remind everyone that you will have access to this information later. I can't tell you a timeline as to when, but we will have these available on the website, and you can access. We plan to have future events for you, and I'm going to allow the chair of the task force, Dr. Ken Wallace, to say a few words about our future plans.
Thank you, Sarah, and thanks so much to all the panelists. And just so you guys know, this is just a sampling of the great members we have on our task force. They're doing a terrific amount of work for you. And this is a unique experience because we're getting information up to the minute. Even during the meeting, we're getting new information tonight. And so everybody's doing a great job. I have a couple of quick requests. First, know that there's a lot of frustration. And members sometimes will have a tendency to want answers from the Dental Society, and they will call our staff and try to get some of those answers. Please be kind when you do that. I know you're frustrated. Our staff is working so hard right now. They do have a lot of answers, and we're trying to support them with that. But please, treat them with all the respect they deserve. They've done a terrific job. They are trying to get recordings of the first 2 nights on the Dental Society website tomorrow. Hopefully that'll happen. And then for this meeting, it'll probably be early next week, I would imagine. We are also trying to answer all the unanswered questions from the last couple of nights. We're going to try to put a document on the website in the next few days that will have answers to all your questions. If you have more questions, I think you can continue to send those to the Dental Society. And it's the Connect one. Maybe you know that, Sarah, the address for that.
content@sccds.org.
And we do plan to have more opportunities to share information as it comes out. Our task force meets tomorrow to decide what the next best subject matters would be. There's a ton of stuff out there, and we want to do the best we can to provide it. We probably won't be doing 3 a week like we did this week, just because it's a little too overwhelming for all of us. But we're going to get you guys back and going here real soon. Thanks for listening and tuning in tonight.
Thank you, Ken. I appreciate it. And I want to thank everybody again for taking the time, spending your evening with us. I hope that you found this information helpful.